Health officials warned the latest wave of COVID outbreak would be explosive, as Hong Kong has been ravaged with 101 new coronavirus cases today. Infections in various clusters, including dance clubs and care homes for the elderly, have kept ballooning. Johanna Chen reports.
63 out of 101 local cases were linked to previous infections, and 29 of them have no known source of transmission. 18 more infections were linked to the dance club cluster, taking the total to 625. 6 more cases were recorded at Ho Yok Ching Willow Lodge, a care home for the elderly in Tai Kok Tsui, taking the total cases to 10. The infections at Lohas Park construction site stood at 34, while the infections at Fong Shi Chun Day Activity Center soared to 57. There were 40 other linked cases, including a nurse at Dr. Fok Lai Singh's private clinic in Whampoa Garden, and close contacts have been quarantined. The latest untraceable cases also included a student of Mun San College, which will be closed for disinfection.
This is very worrying because this signifies that there are a lot of silent transmissions in various places in the Hong Kong community. If the situation continues, at some point we may encounter explosive outbreaks in the near future.
Meanwhile, a nurse from St. John Hospital in Cheung Chau had to undergo medical surveillance and get tested for the coronavirus after a resident had poured deep throat saliva samples on a desk in the nurse's room. The hospital authorities said the nurse had worn protective equipment but would still undergo tests for safety. Taxi drivers will be required to take a mandatory COVID test within 2 weeks, starting from next Wednesday. In light of COVID, MTR Corporation announced the Kwun Tong and Island lines will reduce train frequencies from next Saturday, and there will be no overnight train service on Christmas Eve and New Year's Eve. The city's COVID tally now stands at 6,802, with 112 deaths. Johanna Chan, HKIBC.